Yes.
Hi.
Hey.
My name is Dr. Perez.
How are
How's
you?
it going?
Good, good. How are you?
I'm doing well. Thank you for asking. It's very nice to meet you.
You too.
And this is Baby Cat, correct?
This is Baby Cat,
Okay.
yes.
It's nice to meet you too. So let's go ahead and jump in. It looks like we are doing kind of a complete head to toe with cognitive assessment today.
All right.
Okay. So is there anything specific that brought you in, or are we just doing kind of an annual checkup?
Just an annual routine checkup.
Okay, perfect. So if I can just first have you confirm your first name for me.
Sure. James.
Perfect. And your age?
30.
Very good. And you agree that you are here for an annual exam?
Yes.
Okay. So I'm just going to start with a series of questions about your basic everyday life.
Okay.
Do you eat mostly a regular diet?
Yes, I do.
Okay, and I have your code status as full code in case of an emergency.
That's correct.
Okay. You typically void and have bowel movements kind of up to the restroom independently?
Correct.
Okay. Do you ever require any assistance with toileting, bathing, grooming, anything like that?
No, I don't.
Very good. So pretty independent at baseline. Okay. Currently taking any medications?
No, no medications.
Okay. Perfect. So why don't we go ahead and get started with some questions about your medical history.
Okay.
I do have quite a few questions to go over, so please bear with me.
All right.
All right. Any history of previous head injuries?
No.
TBI or traumatic brain injury?
No.
Any history of falls?
No.
Any blows to the head or hits to the head?
No.
Okay. Any neurological impairments that I should know about?
No.
Any numbness anywhere on your body?
No.
Tingling?
No.
Any pins and needle sensations?
No.
Perfect. Any changes to your scalp, dandruff, scalp psoriasis, dryness, itchiness, anything like that?
No, nothing like that.
Any eye pain?
No.
Blurriness?
No.
Floaters?
No.
Any tearing? Excessive tearing?
No, no
Excessive
tearing.
dryness?
No.
Okay. Any loss of vision?
No.
Any double vision?
No.
Perfect. Any changes to your nose or your nostrils?
No, none.
Nose pain?
No.
Abnormal bleeding?
Mm-mm.
Dryness?
No.
Drainage?
No.
Any loss of smell?
No.
Any abnormal smells or smelling something that's not there?
No.
And any burning of the nares?
No.
Your nostrils burn. Okay, perfect. Any oral changes, oral health changes, anything to do with your mouth?
No, none.
Mouth pain?
No.
Any bleeding?
No.
Dryness?
Nope.
Excess saliva?
No.
How about any swelling of your gums or kind of anywhere else in your mouth? Any swelling of your tongue?
No.
Okay. Any abnormal taste, or are you tasting something that's not there? Do you taste something differently than what you're eating?
No, I don't.
Perfect. And then lastly, for your oral health, is there anything like any symptoms of numbness, tingling of your mouth,
No.
loss of sensation in your tongue?
Nope.
Okay, and then any popping or locking of your jaw?
No, none at all.
Perfect. Okay. Now for your ears, are you having any ear or hearing changes?
No, I'm not.
Any ear pain?
Nope, no ear pain.
Ear drainage or excess cerumen or earwax production?
Nope.
Okay. Any itchiness of the ears?
No, no itchiness.
Okay. And no loss of hearing?
None.
Any ringing or tinnitus in your ears?
Nope.
Okay. Okay. So now for your kind of chest, arms, upper body, any changes or abnormalities there?
None that I know of, no.
Okay. Any upper body pain?
No.
Aches?
No.
Spasms?
No.
Stiffness?
No.
Popping of any of the joints?
Sometimes in my elbows I get a little popping.
Okay.
That's about it.
And is that with increased movement or just kind of stiffness first thing in the morning, or just kind of random?
First thing in the morning, just could be random as well.
Perfect. So I'll just make a note of that. and then kind of sporadically. Okay. How about any, let's see. Okay, so any drainage or weeping coming from any of your upper extremities, like weeping of the limbs, sometimes we'll get excess fluid production, anything like that?
No, nothing like that.
Okay. Now, as far as your abdomen, are you having any stomach or abdominal changes, any changes in your GI?
No.
No, okay. So no pain currently. What about any stomach aches?
No, none.
Spasms?
No.
How is your voiding schedule? Are you voiding regularly? You're able to produce urine on a regular, kind of every 5 to 6 hour basis?
Yes, I am.
Okay. And what about bowel movements? Are you having normal bowel movements?
Yep,
No
regularly.
issues with consistency, diarrhea, constipation, anything like that?
Nope, none of that.
How is your appetite? Any loss of appetite or increased appetite?
No, it's normal.
Okay. Any unexplained weight loss or weight gain?
No.
Perfect. Now moving on to your lower body, so this will include your legs, groin area, and your feet. Any changes or abnormalities there?
Nope, none.
Any pain in any of those areas?
No, no pain.
Any aches in your legs, knees, ankles?
No.
Spasms?
No spasms.
Stiffness?
Nope.
Popping in any of the joints?
No.
Okay. Any contractures, which would be like an inability to flex your legs normally?
No, none.
Okay. And any drainage or weeping in any of those areas?
Nope, none.
Any abnormal discharge in your groin area?
Nope.
Perfect. So moving along to your back. Any changes in your back?
No.
Any back pain?
No.
Aches?
No.
Spasms?
No spasms.
Any stiffness?
No, just regular old age stiffness, that's all.
Okay. All right. And any popping of the back or spine?
No, none.
Any spine abnormalities? Have you ever been told that you have scoliosis or curvature of the spine or
No,
any?
nothing like that.
Perfect. And then lastly, any drainage or weeping? Probably not.
No, none at all.
Okay, so let's go over your kind of neurological health. Any changes there? Have you noticed any difference in your alertness or awareness?
No.
Are you noticing any mental fog, memory changes?
No, none of that.
Okay. Any excess tiredness?
No.
You're not forgetful?
No, I'm not.
Okay. No changes to your memory or increased memory loss?
Nope, nothing.
Hallucinations?
No, none of those.
And how are your moods doing? Any changes, mood swings, anything like that?
No, fairly level and normal.
Perfect. All right, James, well, that is all I have for now as far as your pre-exam assessment.
Okay.
So let's go ahead and move on to get a set of your vital signs.
All right.
So I'm just going to grab a couple things here. Alrighty, so I'll just be placing this kind of in front of you.
Okay.
And I do want to start off by checking your temperature. Okay. Can I have you lift your tongue for me?
Sure.
And go ahead and close your mouth. Okay, go ahead and release. Perfect. So your temperature was 97.3, which is within normal limits.
Okay.
It's a little on the cool side. Have you had something to drink recently?
I have, yes. I just drank water before I came in.
Okay. Was it cold?
Yes, it was.
Okay. So I'm going to place this on your left index finger.
Okay.
And then I will get that plugged in for you. So for now, let's just let that hang out. And I'm actually going to go ahead and do a wrist blood pressure today. I don't think we need to check it on your arm. I didn't see any history of abnormal blood pressures in your past.
Okay.
if I did, we would be more concerned with getting a more accurate reading, but I think the wrist should be fine for today. So I'll have you just relax your hand down like that. I'm gonna turn this on. Okay, just breathe normally for me and I'll get this plugged in. Okay, so blood pressure is slightly elevated. Okay, and your pulse, I did count manually, it was 79, which is consistent with what I got on the machine.
Okay.
And your respirations were at about 18, which is normal.
Okay.
Okay, so we will keep an eye on that blood pressure. Okay, so let me just take a couple of notes there. Okay, so your oxygen was 98%, your temp was 97.3. All right, so let's go ahead and move on to the next portion of our exam. Do you have any questions for me so far?
No, I don't.
Perfect. So the next part of our exam will be assessing your neurological functions more in depth. So I do have a couple questions and a few scenarios that I will be having you complete.
Okay.
So to start, I will be assessing your short-term memory. So can you tell me what you ate for breakfast this morning?
Sure, I had an omelet with bacon, onion, and cheese.
Very good. And can you tell me what my name is?
Yes, Dr. Perez.
Very good. How did you arrive here today?
I drove.
Okay. And can you tell me what day of the week it is?
Yes, it is Wednesday.
Very good. And what is today's date?
Today is August the 22nd.
Very good. Okay. So now let's assess your long-term memory. Can you tell me what your favorite subject in school was?
Yeah, it was math.
Okay. What age were you in the 6th grade?
12 years old.
Okay. Can you tell me what your mom's retiring career was?
Sure, she was a crossing guard.
Crossing guard. Okay, can you tell me your grandmother's name?
Sure, Eloise.
Beautiful name. Okay. What street do you last remember living on as a child?
Stillman Street.
Very good. So short and long-term memory both seem to be intact.
Okay.
So I'm going to have you repeat a few phrases, words, possible numbers after me.
Okay.
Okay, so can you say Jack, John, Jill?
Jack, John, Jill.
Cat, Dab, Mob.
Cat, Dab, Mob.
Perfect. Flow, Throw, Willow.
Flow, Throw, Willow.
157, 189, 236.
157, 189, 236.
My name is James.
My name is James.
Very good. Okay. So now I'm going to test your memory with a couple words and number sequences. So I'm going to give you 2 words and I want you to repeat them.
Okay.
Apple folder.
Apple folder.
One more time. Apple folder.
Apple folder.
Remember those words. Now I'm going to give you 2 numbers. 59, 17, and I'll have you repeat them.
Okay, 59, 17.
One more time. 59, 17.
59, 17.
And we will come back to that, so try to remember the numbers as well.
Okay.
Can you solve these series of numbers verbally for me?
Okay.
8 times 1.
8 times 1 is 8.
9 plus 5.
9 plus 5 is 14.
Good, and you are welcome to use your hands if need be.
Okay.
18 minus 6.
18 minus 6 is 18 minus 6, 18, 17, 50, 12.
Very good.
18 minus 6 is 12.
2 divided by 1.
2 divided by 1 is 2.
Okay. Now can I have you solve these two problems on my paper? So
Okay.
you'll see here 21 times 3.
Okay.
You can use the space below it as scratch paper, and I want you to write the answer in the space next to it.
All right, over here.
Mm-hmm.
This one is addition.
Yes. Very good. Okay. So no discrepancy with that. Can I have you repeat those two numbers that I told you earlier?
Sure, 59 and 17.
Perfect. And the two words?
Apple folder.
Very good. So no issues with your memory. Cognitive functions appear to be intact for the most part, okay? So let's go ahead and move on to the physical portion of your exam. And I have several things that I will be testing, but we'll start with kind of an overall visual inspection, make sure everything's going okay.
Okay.
Okay, so from this point on, you will hear me taking notes on my keyboard.
All right.
So I do just quickly want to have you have a look at this stroke card for me.
Okay.
So can you quickly tell me what this boy appears to be doing in the picture?
He appears to be getting cookies out of the cookie jar while standing on a stool and also losing his balance on that stool.
Okay, would you consider that a safe situation for a child?
No, it's not safe.
Okay. Do you see anything else that might be considered unusual?
Yes, the mother is washing dishes, but the sink is overflowing and onto the floor.
Perfect. Can you tell me how many people you see in this photo?
3 people.
Very good. On the other side here, can you point to something that requires water to live?
Yes, this cactus.
Very good. Is there anything else?
This feather, possibly, depending on what it's attached to.
Okay. How about these two trees?
Okay, yeah, I didn't see the trees in between the hammock.
Okay, very good.
Okay.
Can I have you read the last line on this card?
Yes, baseball player.
Very good. And what about this here?
Thanks.
And I want you to just read this sentence to yourself.
Mm-hmm.
Can you tell me what the verb is?
Yes, the verb is got.
Very good. Okay. So let's go ahead and move on. Okay, so for the initial kind of visual inspection here, I'm going to be having a look with my pen light. Alright, so let's go ahead and get into the physical portion of the examination.
All right.
I want you to just kind of sit naturally as you would. I'm just going to have a look at you with my pen light.
Okay.
Just looking for any kind of very obvious abnormalities that might be on the surface. Just going to have a look at your skin overall. And I'll have a look at your lower extremities a little bit later on in the examination. Okay, can I just have you turn your head here slightly for me? Very good. Okay. Alrighty, so let's go ahead and move on to an examination of your eyes. I have a couple things that I will need to test, and I'm going to start by attempting to visualize different parts of your eye. Okay, so I have an ophthalmoscope here. And is it all right if I remove your glasses?
Sure.
Okay. So I'll just set these here for just a second. Baby cat can keep those safe. And I want you to open your eyes wide and just look straight ahead for me. Just visualizing your optic disc. And can I have you look up for me? Perfect. Okay. So let's do that on the other side. Perfect. Okay. So optic disc is intact. And I'll have you keep your glasses off momentarily. So I'm going to be doing a follow the light test.
Okay.
So I want you to follow the light with your eyes. Do not move your head, okay?
All right.
Pull it all the way in. Perfect. Now we want you to look at my finger. Now look at the light. Again at my finger. And at the light. One more time. Look at the light. Very good. Okay. So look straight ahead for me. I'm just going to test pupillary reaction. I'm looking for normal constriction and dilation, which I am seeing an equal response. So next what I'm going to do is perform a swinging light test. So just keep your head kind of midline. I'm going to hold your forehead here and just quickly swing my light back and forth. Perfect. Okay. So no abnormalities there. So let me just take a quick note here. So far, getting normal constriction and dilation. Reaction, I would say, is 2+. Okay, so let's go ahead and move on. The next thing I want to do is test your corneal reflex. So I have a Q-tip here. It's very soft. It is clean. I'm going to be touching the corner of your eye with this, and I want you to just allow yourself to react naturally, okay?
Okay.
So just look straight ahead for me. This is slightly uncomfortable. Very good. Okay. So just looking for that normal blinking of the eye, which I did see. Okay, so why don't we go ahead and move on to another portion of your eye exam. So what I'm going to have you do is, I have this ocular occluder, so I want you to use it starting like this. You can cover whichever side you prefer. Okay, so this is an Acuity card. Can you see the biggest letter on this card?
Yes.
Can you tell me what that is?
It is E.
Okay. Are you able to read this third line down?
FPH.
And what is the smallest line that you're able to read?
EFTZG.
Okay. Are you able to read the line below that?
CFDHJ.
Very good. Can you switch eyes for me? Can you read this big letter here?
E.
And let's try the fourth line down.
OLCF.
What is the smallest line you can read here? Can you read this one?
Trying to EPTZO.
Very good. What about the line underneath?
Oh. Not really.
Okay. So let's try that with your glasses on.
Okay.
Basically, I'm just testing to see if your glasses are the correct prescription, keeping in mind the mistakes you made on the first one.
Okay.
So let's occlude the original eye. And I want you to read this line for me.
EPTZO.
And the bottom line.
CFDHJ.
Can you read the last one?
LTFPH.
Very good. Switch for me. So again, let's try here.
EPTZO.
Here.
CFDHJ. LTFPH.
Very good. Can you tell me what color this is?
That's red.
And this here?
That's green.
Which of these circles would you say is smaller, 1 or 2?
2.
Very good. Okay. So your glasses are obviously up to date and they are doing very well. So I want to put this down now. I'll have you hold that up and include whichever side you prefer. Can you see all of me here?
Yes, I can.
Can you tell me how many fingers I'm holding up on each hand?
2, 3, 5.
Switch for me.
3.
On this side.
5, 5, 3, 5, 2.
Very good. So that's testing for glaucoma. So let's move on to test for color deficiency, and I'm going to test this in 2 different ways.
Okay.
So this is an Ishihara test plate booklet, and so this is just an example. Can you tell me what color this is?
Sure, that's 12. I'm sorry, the color is orange.
So the first one will be just an example. Can you tell me what number this is?
Yes, this is number 12.
And what color is it?
It's orange.
Perfect. Can you tell me if you see a number here?
I do. Number 8.
And here?
Number 5.
Here?
29.
And here?
74.
Here?
7.
And here?
45.
Here?
2.
Here?
No number.
Here?
16.
Here?
No number.
Do you see anything here?
Yeah, it's a snake-like pattern.
Can you trace that with your right index finger?
Sure.
Very good. So Ishihara test plates are not showing any signs of color deficiency. So let me test that in just one more way. So I have a couple test tubes here that we will be using later on.
Okay.
Can you tell me what color this is?
It's red.
This
Purple.
here. Can you tell me which of these you'd say is darker?
The red one.
And what color is this?
Pink.
Which of these would you say is the lightest?
The pink.
And of these 2, which would you say is the darkest?
The purple.
What color is this?
Mint green.
And this one here?
Kelly green.
Okay. This one here?
Purple.
Very good. And this one?
Blue.
Okay. Can you tell me, I put all of these together, and as far as like similar color patterns or in the same color family, which would you say does not belong?
The purple.
Very good. And if I did these, which would you say does not belong?
The green.
Very good. Okay. So definitely no issues with color deficiency. All right. Let me just catch up on my notes.
Okay.
Do you have any questions for me so far, James?
No, I don't.
Color deficiency test was normal. Acuity with your glasses is about 20/25. Okay, very good. All right, so let's go ahead and move on. Just want to make sure we're not missing anything here. So why don't we move on to a nose exam? And I'm going to start by testing your nasal patency. I will be touching your face, so I'm going to go ahead and put on a pair of gloves. Okay, so to start, I'm going to test for nasal patency, which means I'm checking for any nasal occlusions, any signs of kind of seasonal allergies, or any other discrepancy with your nose. So I'm just having a look first. Don't appear to have any signs of a deviated septum, but I will go ahead and have a look with my otoscope here.
Okay.
Okay. So if I could have you tilt your head back slightly. Okay. So septum is midline. And what I'll do now is occlude one side, and I'll have you take a breath. And again. In breathe through your mouth. Then out through your nose. Very good. Okay, so no signs of occlusion. Okay, so what we're gonna do now is test your ability to smell. And the way this test is gonna work is initially I have a few different ones here and they're all a different scent.
Okay.
And I'm going to give you 3 options of what it could potentially be, and I want you to pick one of the 3, okay?
Sure.
So this first one, go ahead and take a whiff of that for me. And do you think that is orange, lemon, mint, or neither?
Am I able to hold it and smell
Of
it?
course.
I can just smell the gloves, unfortunately.
So orange, lemon, mint, or none of those?
Mint.
Very good. Okay. So I will give you this one. Go ahead and take a whiff. Is that strawberry, grape, or watermelon, or neither?
Strawberry.
Very good. I will give you this here. Go ahead and take a whiff. Would you say that's lemon, dill, mustard, or neither?
Mustard or dill? It's a little spicy, so I'll say mustard.
Okay. So I'll give you this here. Can you tell me if that's onion, coriander, or smoke?
Coriander.
Very good. So 2 more with the option. So I will hand you this. Can you tell me if that is smoke, mint, or charcoal?
Smoke.
Okay. So last one here. Go ahead and take a smell. Can you tell me if that's orange, lemon, or eucalyptus?
Eucalyptus.
Very good. Now this last one, I want you to tell me what it is. No options.
It's sweet and flowery. Blueberry?
Okay. It's honey, actually.
Okay.
But I can see why you would say that. It does have a little bit of a tart smell to it.
Okay.
Okay. So let me just go ahead and type a few of that in.
Okay.
So the last one you did get incorrect, but you did get the rest of them correct. So
Okay.
it's still considered a normal reaction. Could possibly have blueberry in it actually, because honey obviously derives from whatever plant the bees are
True.
utilizing, so it is a possibility. Okay, so let's go ahead and move on to your oral examination. So I am going to visualize your throat, and I want you to open and say ah. Very good. Having a look at the hard and soft palate. Can you lift your tongue for me? Very good. Teeth look healthy. Can you go like this? Good. Okay. Now open. Close your eyes. Okay. Sorry. Very good. Gag reflex is intact. I apologize. I know that's not the most pleasant part of the examination. So I am going to go ahead and check for TMJ. So I'm looking for any abnormalities in your jaw, checking for any clicking, popping, anything like that. So can I have you open and close, open, close, open, close. Can you move your jaw like this? Any pain or discomfort with that?
No.
Okay, and I'm not hearing any clicking or popping. Okay, very good. Alrighty, so that is all seemingly normal. Gag reflex is intact, and I am going to go ahead and test your swallow. So if I could just have you swallow hard. One more time. Very good. Okay, so no abnormalities with that. Good job. Okay, so let's move on to your ear exam. And I apologize if I'm moving quickly. We have quite a bit to go over today.
It's okay.
So I have an otoscope here. and I am going to be having a look in your ears. So attempting to visualize the eardrum. Okay. Good. Eardrum is pearly white and no excess production of cerumen. And this rumen that you do have is yellow and not cloudy or brown, no signs of abnormal discoloration. Okay. Good. Can you turn this way for me?
Sure.
Eardrum is visualized. No excess production of earwax or abnormal discoloration. No signs of any foreign bodies or any other concerns there. Very good. Okay, so let's go ahead and move on to an ear exam. I am going to test the health of your eardrums.
Okay.
So I will be pumping kind of a strong gust of air directly into your ear. I want you to tell me if this causes you any pain or discomfort, okay?
Okay.
Is that painful at all?
No, it's not.
Okay, let's try this side. Any pain there?
Nope, just a little ticklish.
It's okay. So that basically tests for any perforations of the eardrum. If you were feeling a sharp stabbing pain, then obviously we would be concerned that your eardrum might have a tear.
Okay.
Okay, so why don't we move on to your hearing test, which I will be performing a couple different ways. So the first one, you can close your eyes for me. Tell me if you hear this equally in both ears. Does it sound any different side to side?
No, it didn't.
Okay.
It's both is fading out.
Okay. Can you hear that?
Yes.
Can you hear that?
Yes.
Does this sound louder than this?
Yes.
Okay. Can you hear this?
Yes.
And this?
Yep.
Does this sound louder
Yes,
than
it
this?
does. Mhm.
Very good. Just tell me when the sound stops.
Stop. Stop.
Very good. Okay, so for the next portion of your hearing test, I'm going to be making various sounds with my hands.
Okay.
And I want you to just say yes when you hear something, okay?
All
So
right.
keep your eyes closed for me.
Yes. 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 Yes.
Good. So now I will be making clicking sound. Can you hear this?
Yes, I can.
This is testing your directional hearing. I want you to tell me what side you hear it on. It could be front, back, top, side to side. Let me know, okay?
All right. Right. Front. Left. Top. Top. Right. Right. Left. Front. Front. Top front. Top. Front. Right. 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 Right.
Okay. So now I'm going to move from your right side to your left side. I want you to tell me when it's at your left ear.
Sure. Left ear. Right ear.
Very good. Okay. So I am not suspecting any abnormalities with your hearing.
Okay.
Did you have any questions or concerns there?
No, I don't.
Okay. Very good. Okay. All right, James. So I am going to move on to an examination of your neck
Okay.
and thyroid area.
Okay.
So I want you to tilt your head back as far as is comfortable for you. And you're going to feel me palpate around your neck, throat, clavicle area, okay?
All right.
Just palpating your lymph nodes, looking for any potential signs of swelling or abnormal edema in this area, which can indicate either an infection or possible indication of thyroid disease. You're going to feel me kind of move your neck back and forth. I know that can be slightly uncomfortable. I'm going to feel along your clavicle or your collarbone area. Is there any pain or discomfort in any of these places?
No, there's not.
Okay. And pain or discomfort here?
No.
Perfect. Can I have you bring your chin to your chest? Okay. So while I have you like this, I am just going to briefly feel your head and scalp. Checking for any abnormal nodules, any signs of cranial inflammation. Also feeling for the integrity and thickness of your hair. Not feeling anything abnormal. Is your head itchy at all?
No, it's not.
So hair texture is thick, healthy, no signs of balding, abnormal color and texture for ethnicity and age, no signs of thinning along the hairline. Perfect. Okay. So let's go ahead and move on. I do want to percuss along your clavicle, so you're going to feel some light taps along your collarbone. Shouldn't be painful. Any pain or discomfort there?
No, no pain.
So now right along your breastbone. Just percussing along your chest wall. Good. Okay. So I have a stethoscope here, and I'm going to use this to auscultate your heart. So just breathe normally. Can I have you lean forward for me? Okay. So the next 3 times I touch you with the stethoscope, I want you to say 99 out loud.
99. 99. 99.
Very good. Okay. So go ahead and lean back. I'm going to do some gentle percussing along the chest wall. Good. Okay. So that was just allowing me to hear for any abnormalities in your chest wall, in your heart, listening for any possible buildup of fluid in your lungs, which I did not hear.
Okay.
So, cardiovascular health as well as your pulmonary assessment were both within normal limits. Lung sounds were +2. You are in normal sinus rhythm, which indicates a healthy heart. So that is very good. So let's go ahead and move on to an examination of your upper body. For this, I will be having a look at your arms and kind of briefly along your abdominal area. You're not experiencing any abnormalities there at this time, so we don't need to do like a full abdominal assessment, but I will just be kind of palpating around. Okay.
Okay.
So I do want to have a look at your arms. Just looking for any skin abnormalities. You don't have any signs of dermatitis or psoriasis. While I have you here, I'm just checking for normal capillary refill. This also allows me to check your nail health and hygiene, which appears normal. No signs of cuticle splitting or excess dryness there. So let's do the same on this side. I do see some slight scarring here, but overall nothing abnormal. Do you wear sunscreen?
No, I don't.
Definitely recommend wearing sunscreen on a daily basis, especially if you're going to be outside. I do see some discoloration, so your true pigment is here. And as you can see, you're quite a bit darker here, so it is important that you wear sunscreen to protect your skin. But other than that, I'm really not seeing any abnormalities. Cap refill is less than 1 second. Nails are well groomed and healthy. Cuticles are not overly dry. No signs of palmar erythema, and just have a look at this hand, just checking for swelling of the joints or any signs of arthritis, which I'm not suspecting here. Okay, so visual inspection of the upper extremities is within normal limits. So for the next portion of the exam, I am going to do some percussing with my reflex hammer on your abdomen.
Okay.
So just lean back as much as you can. Go ahead and relax. Okay. So now you're going to feel me kind of gently palpate this area. Good. Now I'm going to go slightly deeper. Okay. Abdomen is soft. Does not appear to be hard or no signs of any thickened tissue. Organs are not palpable at this time. Any pain or tenderness as I go deeper here?
No pain.
Slightly uncomfortable probably. Okay, so if I can have you rest your arms kind of palm up, very good. So I want you to just bend at the elbow slightly, just like that. So I'm checking for normal muscle reaction, so just relax, there you go. Good. Here's one. Okay, good. Now I want you to palms up for me here. Just relax. I want you to close your eyes. And if you can hold your hands out, up in the air, so straight forward like this. Close your eyes for me. Keep your palms out. Very good. Okay, you can go ahead and relax. So, muscle tone, reactivity is normal. Your upper extremity reflexes are intact. And your abdomen appears healthy. You said you have normal gut health, no issues with IBS or anything like that, right?
No issues.
Any sensitivities to any food, lactose intolerance, anything like that?
I am lactose intolerant. Yes.
No food allergies, correct?
No.
Perfect. Okay. Alrighty, so let's go ahead and move on. So I am going to do some very minor palpations of your lower body. So I will just uncover you for a second.
Okay.
Okay. I'm just going to have a look at your skin. Mainly looking at your joints. Checking for any signs of inflammation. You're a little young for arthritis. We go more in depth with the arthritis examination at about 40 years old.
Okay.
So you're not quite there yet. And I'm not noticing any signs of edema or any cause for concern. No kind of discomfort as I move your knee around.
No.
Okay. Legs are a bit cold to the touch. Do you have any issues with poor circulation?
Yeah, right now my legs are a little asleep.
Okay. Okay, so I am going to just gently percuss along your knee. Not hearing any hollowness. Any pain or discomfort here?
Slightly, yeah.
On this side only?
Yes.
Okay, so that might be something that we need to come back to in a more in-depth examination. I am feeling kind of a slight abnormality in your kneecap.
Mm-hmm.
Can't quite pinpoint what that is though. Does that hurt?
Discomfort.
Okay, so we will need to have a closer look at that. I don't have time today, unfortunately. I do have another patient coming in after you.
Okay.
So if possible, I would like to schedule you for an examination and we can have a look at your lower
Okay.
extremities a little more in depth there, okay?
We can do that.
Does it hurt to walk on that?
It doesn't, no.
Okay. So I'm just gonna make a note here.
Okay.
Left knee. There's a slight abnormality in feel of the joint. It's not swollen or edematous, and you do have feeling. You were able to feel me touching it, correct?
Yes, I was.
So there's no nerve damage, at least no suspicion of nerve damage, but I do want to have you come in for kind of a more in-depth inspection. Okay. Alrighty, so let's go ahead and move on to a sensation exam, and this will be the closure of our examination today.
Okay.
So, actually, I'm sorry, one more thing. Can I have you hold your hand out for me?
Sure.
So I'm gonna put this tourniquet on you, and it's gonna be a little tight, and I'm just looking for skin turgor, elasticity, normal reactivity, which I am seeing. Okay, so I'll look on this side as well, and this just tests for any signs of collagen deficiency. If there are any symptoms of dehydration, this is a good test for that as well. And normal reaction there. Okay, very good. All right, James, so the last part of this examination is going to be a sensation test, and this will only take a few minutes.
Okay.
I have a couple different items that I will be testing here, mainly on your face and arms, okay?
Okay.
So to start, I have these 2 Q-tips here, and I want you to close your eyes for me. Can you feel this?
Yes.
And this here?
Yes.
Yeah.
Yes. Yes. Yes.
Do you feel this in 2 points?
Yes, I do.
2 points here,
Yes.
here,
2 points.
here,
Yes.
as well as here.
Yes.
Does this feel sharp to you?
Yes, it does.
Sharp here,
Yes, it does.
here.
Yes. Yes. Yes.
2 points.
Yes. 2 points. Yes. Yes.
Good. Okay. Now, I am going to run this along your arm. I want you to tell me when it starts and when it stops.
All right. It started. It stopped. Started. Stopped. Started. Stopped. Started. Stopped.
Good. And here?
Started. Stopped. Started. Stopped.
Good. Okay. Now I have a bit of a sharper tool here. So this is quite obvious feeling. So I want you to say yes when you feel it, okay?
All right. Yes. 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 Yes.
Any difference in feeling as I go down towards your hands?
No, I don't think so.
And on this side?
No.
And here feels the same?
Yes, it does.
Here and here, is that any different?
No, it's the same.
Here and here?
Yes.
Perfect, okay. So lastly, for your sensation test, I'm going to be placing a cold object on your skin. I want you to say cold when you feel it.
Okay. Cold, 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 cold.
Can you tell me if this is cold or warm?
Warm, cold, warm, cold, cold, warm, warm, cold, warm, cold.
Very good, okay. All right, James, well, the good news is that concludes your examination today, and the only abnormality was that in your left knee.
Yeah.
Okay. So I do want to have you come back in for that if possible. I want to have a look at it. I'm not quite sure what's going on. You don't have any recent falls, so it's not like it's a suspected injury.
Right.
I'm not noticing any swelling at this time.
Okay.
It's not causing you any impairments in your gait, correct? Do you notice that
No.
you're limping or?
No.
Okay. So let's go ahead and make an appointment for you to come back in and I will have a look at that.
Okay.
Chelsea is up at the front desk. I will walk you out to her and let her know what's going on. She can make you that appointment and we'll get you in. It's not emergent, but I would like to see you in the next couple weeks if possible, okay?
Okay, that's fine.
All right, perfect. Well, let me just move these out of your way, and if you'll follow me up to the front desk, we'll get that taken care of.
Okay.
Perfect, thank you.
Sure.
Hi, James.
Hey.
So this is Bruce?
Yes, this is Bruce.
Wow, okay. Very nice to meet you, Bruce. So you are in for just a quick little examination to make sure everything is okay. Why don't we go ahead and have a look? I'm just shining a light to look inside of his ears.
Okay.
Not noticing any excess earwax. Oh, you're so handsome. Can I look at your eyes? Why don't I hold you? Is that okay? Good boy. Good boy. So normal reaction to the light. Bruce, I'm just gonna have a look at your teeth. Can you show me your teeth? Wow, very good. Okay, so his teeth look very healthy. How about your hands? Very well groomed. Nails are trimmed, and he appears clean and well fed.
Yes, he is
He's
well
a little
fed.
chunky. Okay. Is he having normal bowel movements?
Yes, he is.
Okay, so no issues with that. Bruce, can you come here?
No.
No, Bruce is over it.